Hello, my name's Brook Ward. I'm the President and CEO of the Washington Health System. Very happy to be back with you for our 7th Friday video where we attempt to answer questions about what's going on in our healthcare world and how it's impacting the Washington Health System. First topic I wanted to talk about today was blood drives. Hopefully everybody understands how critically important it is that we have ample supply for our community when patients need it. And as you can imagine, the last 2 months we have not been able to hold a blood drive. So we're going to hold 4 of them in the month of May. And we hope that following this video, some of you will schedule to come in and volunteer to give blood. Fortunately, 2 of the dates are already filled. May 13th and May 16th, we already have those full, which is great. We have 2 other dates if you'd like to schedule. Wednesday, May 27th from 1 p.m. to 6:30 p.m. And the second one is May 30th, which is a Saturday from 7:30 a.m. to 2 p.m. All these are being scheduled and being done at the Wilfred R. Camlin Wellness Center. Now, we're going to include a link below this video that you can use to schedule the appointment. Unfortunately, we cannot do walk-in visits just to make sure that everyone is safe and sound in this environment. And remember, you need to use the group code C5300001 when you're scheduling online. So please consider making a donation. Switching subjects then, last fall, we brought 2 new non-invasive cardiology procedures to the Washington Health System. One is called TAVR and the other one's called Watchman. TAVR is a non-invasive, non-surgical approach to replace your aortic valve. And so typically someone would come in, have open heart surgery, have their chest cracked open, replace the aortic valve. Now we're taking them to the cath lab, running a catheter up there and replacing it. The person, it's a simple procedure. They spend 1 night in the hospital and they walk out the next day. The Watchman is very similar. This is a device that deploys over the left atrial appendage for those people who have AFib to prevent blood clots from forming. So we can take them to the cath lab, run a catheter up to that area, deploy the Watchman device to prevent that from happening. Both of these were great advancements for our community, and they help in healing and recovery much sooner than you would otherwise. This week, we had a new procedure to add to that list. It's called a percutaneous mitral valve replacement. So this is for people who would need surgical mitral valve replacement normally. Now we can take them to the cath lab again using a catheter to run up there to replace that valve. We did 2 patients this week. Both had great outcomes and good recovery. I wanted to congratulate Dr. Varghese in performing these procedures, and I'm happy we can bring those to our community as another advancement in cardiac care here at the Washington Health System. We're the only hospital outside the city of Pittsburgh to be performing this, and very happy to add that. Next subject I want to talk about is COVID testing. As you know, we have 2 dedicated outpatient locations for people to drive up and have this test done. One is at the Wilfred R. Camlin Wellness Center in Washington County. The other one's at the Medical Arts Building in Greene County, and we're still performing tests at those sites. With everything we've been doing at those 2 sites going back to early March, plus some testing in the ED and our inpatients, we've done over 1,800 tests so far in the last 2 months. And I want you to know our positive rate for Washington and Greene County at our locations. And right now that is at 2.65%, so it's below 3%. I mention that because I want you to know it's very safe. Of the people who did test positive, the vast majority of those people basically got tested, they've gone home, they're quarantined, and they're not here at the hospital. We've had very few people who actually needed to be hospitalized. So our hospitals, our EDs, our diagnostic sites, our physician offices, the surgery department, et cetera, are extremely safe. And I mention this because we're concerned about the number of people who are putting off necessary care because they're more concerned about being exposed to the coronavirus than they are their actual illness. So I want you to know it's safe to come in. And starting this week, Monday, we started ramping up pretty much all services. There are a few exceptions, of course. So it's safe to come in. Please don't put off that necessary care. We want you to be safe and sound, and we're here to take care of you. Now, one of the questions we've been asked in the last week is, are we going to loosen up our visitor policy for those inpatients or go back to our old policy? And the short answer for now is no. And we're only doing that out of preponderance of caution. We want to make sure that everyone is safe. So for right now, we still have a no visitor policy. We are allowing 1 guest to come in for women who are delivering a baby. They can have a support person with them the whole time. And then, of course, we have an exception for end of life for those family members who need to come in. And it's unfortunate, but sometimes that needs to happen. Otherwise, there's very little or no exceptions for now. I'm sure that'll change in the near future. Now, moving on to our physician offices. Again, as we ramp up services, I wanted you to know that every one of our physician offices, both the primary care and the specialty sites, are open with the exception of the family medicine residency site in Cecil. Those physicians are seeing patients in Canonsburg, so you can still see that physician. And I'm sure by the end of May, the Cecil location will be reopened as well. Outside of that, every location and site is open and seeing patients both in person and via telemedicine. So please, again, if you need care, call the office, schedule an appointment. Happy to take care of you either in person or virtually through the telemedicine app. Now, one of the questions we get and have gotten this last week in relation to telemedicine is, do you have to pay a copay for that visit like you would an in-person visit? And the answer is yes. And there's really two reasons for that. The first and most important one is almost everybody's insurance plan has a copay and deductible as part of that plan that is applicable regardless of whether it's inpatient or telemedicine. So that applies either way. But I think the reason people ask is they think the telemedicine visit isn't as important or isn't as critical or valuable. And I would argue it is just as important as an in-person visit. Now, there's not as many people involved. When you come into an office, someone greets you, someone takes you back, someone weighs you, takes your vitals, gets your history, those kind of things. There's also someone outside of the physician who walks you out and checks you out. Those people are not involved, of course. You know, the only person you're going to interact with on a telemedicine visit is the physician or the provider. So you're going to see less people, that's true. But what you don't see is the cost and the infrastructure of that technology. So we have IT support, servers, all those kind of things that make that happen. So there is some expense that has to happen with telemedicine that doesn't with an in-office visit and vice versa. The other thing that most people don't know, regardless of whether you're getting a telemedicine visit or an in-person visit, is the physician and the providers do lots of work before and after you leave. Each and every one of them, before you arrive for an appointment or a telemedicine visit, are doing prep work, looking at your history, looking up your most recent lab results to see if you got them done, what the results were, all those kind of things. And then, of course, they have their time with you either in the exam room or via the telemedicine video visit. And then after your appointment, they have follow-up work they have to do to finish documentation and charting on your behalf, order any results and testing you might need, follow up with referrals. And so there's lots of work that happens before and after. So going back to the original question, is there a copay and deductible for a telemedicine visit? The answer is yes. For all those reasons, I hope that helps explain that. Now, another question we've gotten in the last week is if your employer is opening back up and they're requiring a return to work exam or a respiratory fit test, where can you get that done? That's an easy one. You can go to the Washington Health System Occupational Medicine Department to get that done. To get more information, you can call 724-223-3528 to find out more about that. Now, moving on, next subject, just wanted to acknowledge and thank all of our nurses. This last Wednesday, May 6th, was National Nurses Day. So I want to thank all of our talented and dedicated nursing team across the entire health system. They do an amazing job for our patients and our community every single day. I also want to thank our community for the outpouring and support you've shown to them over the last 2 weeks. Not only them, but our entire healthcare team. And I appreciate that very much. Thank you. While I'm thanking people, I also want to thank all of our donors. Our foundation did a fundraising mailing drive here in the last week, and we literally got hundreds of people who responded back making donations through the mail. It was amazing. It was just one of those wow times, and I appreciate it. It actually brings a tear to your eye. And I just want to take a moment to thank all the donors. Regardless of how much you donated, each and every penny is appreciated. It helps support our clinical care team, the organization, our team members, the entire community. We'll put that money to work immediately to help care for the community and provide great patient care in these unusual and unprecedented times. So thank you for all of that. And lastly, I hope you found this video useful. I hope you found it informational. I appreciate your time and attendance. And if you like this, you can come back, see the next video, which will be next Friday, May 15th. Until then, stay safe. Thanks. Goodbye.